India's 7 northeastern states account for less than 3% of the country's more than 1 billion strong population. But the geographically isolated and remote region is home to more than 30% of India's total intravenous drug users. According to various estimates, there could be more than 200,000 injecting drug users in the region, a majority of them believed to be infected with the deadly human immunodeficiency virus or HIV, which causes acquired immune deficiency syndrome or AIDS. Some 4.58 million Indians are HIV positive, although unofficial estimates put the figure at a closer to 6 million. The figure gives India the largest HIV positive population after South Africa. While the 7 northeastern states is estimated to have a total of about 100,000 HIV positive persons, authorities fear the disease may further spread because of the region's acute drug problem, mainly due to the close proximity the region has with the heroin-producing Golden Triangle of Laos, Myanmar and Thailand. Sharing of needles by drug users in the Northeast, besides promiscuous sex, has led to a quantum increase in the number of AIDS cases. But today, the drug users are passing the infection to the general population in the region through their sex partners. HIV transmission rates from mother to child are also assuming frightening proportions. Hundreds of HIV-infected people have died in the northeastern region with no access to medicines and lack of adequate healthcare facilities. It is in this really frightening context that the AIDS Prevention Society or APS, a frontline community healthcare group, takes the lead in providing some ray of hope to hundreds of people, either drug addicts or people with HIV/AIDS.
APS hotline, good morning, can I help you?
Frantic phone calls like these from nervous and worried parents or guardians are common. Those needing personal counseling are given appointments to visit our counselors in the clinic. Besides, our healthcare workers also reach out to those needing help and support immediately in matter of emergency. Since our inception as a civil society organization in 1990, we have been continuing a relentless fight against HIV/AIDS in India's northeast. The primary focus being on various integrated health management projects carried out either individually or in collaboration with other NGOs. We at the APS have successfully implemented a number of intervention projects in the region with the support of various agencies and networking partners for slowing down the epidemic of HIV/AIDS in the region, besides providing care and support to those already infected with the disease. At our voluntary counseling and testing center, we cater to callers of the APS hotline, besides intravenous drug users and other youths who want to know about their HIV status. After pre-test counseling, blood samples are tested for HIV. Then, a post-test counseling is done before the results are revealed. Those who are negative are counseled to maintain their negative status for life, but those who are tested positive will link them to the care and support program for the people living with HIV/AIDS, or in short, PLWHA. As a regional level community healthcare organization, we at the APS are committed to fight the spread of HIV/AIDS and sexually transmitted diseases and improve the overall health status of the people in India's northeast. Among the various highly successful projects we have undertaken include the targeted intervention programs for truckers, injecting drug users, sex workers, migrant population and street children for slowing down the epidemic of HIV/AIDS in northeast India. We at the APS have also undertaken other programs like care and support programs for people living with HIV/AIDS, AIDS vaccine initiative, women, children, youth and students development and health programs, widows, orphans and those affected by the AIDS epidemic, and last but not the least, research on HIV/AIDS and STD issues. The Healthy Highway Project or intervention project with truck drivers and helpers is one of the highlights of our program. Indeed, a pioneering one in the whole of the country. Guwahati, the principal city of Assam state, is the gateway to the rest of the northeastern states, and hence hundreds of trucks arrive in Guwahati daily from all over the country carrying essentials and other goods.
National highways in the northeast are very important as they are the main entry to the entire northeast by surface transport, and a large number of truckers enter northeast daily. We have a very successful targeted intervention program for truckers in northeast India along National Highway 37, 40 and 44, passing through Beltala, going through Barnihart, through the state of Meghalaya. In Assam, in National Highway 37, a very successful truckers project is going on, and it is a very important program because in a very short period of time, a large number of truckers have been catered to, and they have been reached out very successfully, providing a large number of services for sexually transmissible infections treatment to the truck drivers along the national highways in the Northeast.
Various studies revealed that truckers in large numbers were going for casual and unprotected sex on arrival in Guwahati, thereby heightening the risk of spreading HIV/AIDS. To stymie the danger, we started the Healthy Highway project, the thrust being on creating awareness among the drivers and helpers about the dangers of unprotected sex. Our health workers mingled with truckers, and in no time we managed to penetrate our message of safe sex and also about the disease itself. Behavior change communication, either individually or in group, besides distribution of leaflets, pamphlets, mobile exhibition and slideshows, management of sexually transmissible infections and condom programming form part of this truckers project. That apart, any trucker or helpers wanting some expert medical help come to our mobile clinics, besides our highway clinics where doctors and paramedics are there for help and support. Today, truck drivers from mainland India are spreading the message to prevent AIDS after becoming aware about the disease from our health workers at the APS.
देखो जी ये जे हुण असीं गलत काम करांगे गलत ਇਹਦੇ ਨਾਲ ਗਲਤ ਬਿਮਾਰੀ ਲੱਗ ਜੂਗੀ ਸਾਨੂੰ ਉਹਨਾਂ ਚੀਜ਼ਾਂ ਤੇ ਸਾਨੂੰ ਜੇ ਚਲੋ ਕੋਈ ਗੱਲ ਹੋ ਵੀ ਗਈ ਤਾਂ ਆਪਾਂ ਡਾਕਟਰ ਸੇ ਇਲਾਜ ਕਰਵਾ ਸਕਦੇ ਹਾਂ ਠੀਕ ਹੈ ਕਿ ਨਹੀਂ ਇਹ ਫ੍ਰੀ ਚ ਇਲਾਜ ਹੋ ਰਿਹਾ ਇੱਥੇ ਜਿੱਦਾਂ ਤੁਸੀਂ ਸਾਡਾ ਦੇਖਭਾਲ ਕਰਦੇ ਕੋਈ ਹੋਰ ਜਗ੍ਹਾ ਤਾਂ ਅਸੀਂ ਕਿਤੇ ਦੇਖਿਆ ਨਹੀਂ ਇਹ ਚੀਜ਼ ਹੈ ਜੀ ਤੇ ਡਾਕਟਰ ਵਿਚਾਰੇ ਸਾਡੇ ਕੋਲ ਰਹਿੰਦੇ ਆ ਹੁਣ ਫ੍ਰੀ ਚ ਤੁਸੀਂ ਸਾਡਾ ਇਲਾਜ कर रहे हैं कई बंदे गलत जगह चले एड्स तो जी फिर आगे लग जाता है जी जब हम गलत जगह जाएगा आदमी फिर उसका एड्स से लगेगा जी उसको एड्स लग जाएगा जी एड्स से बचने के लिए यही इलाज है हम गलत जगह जाएँ ना जी गलत जगह जाना अच्छी बात नहीं है
वो जो आपको शिक्षा दे रहा है
हाँ जी वो बहुत अच्छी चीज़ है जी ये जो शिक्षा दे रहे हैं हमको ऐसी जगह कहीं देखा ही नहीं है जैसे आप फ्री में हमारे को ऐसी शिक्षा दे रहे हैं हाँ हाँ जी, अच्छा बात है।
आज हमने देखा है कि जगह जगह पर पे जो एड्स के विषय में प्रचार जो हो रहा है वो बढ़िया ढंग से चल रहा है, कहीं पे कोई गड़बड़ी नहीं है। और आप लोग भी हैं, जितने भी सदस्य वो आते हैं, जगह जगह पर अपना स्टैंड बना हुआ है, डॉक्टर भी सामने में है। जिस मरीज़ को जिस चीज़ की ज़रूरत होती है, जिस बीमारी की, ये कोई बात नहीं है कि सिर्फ एड्स ही हो, और तरह का भी होती है, वो सब तो हो ही रहा है। आप लोगों का काम तो चल ही रहा है बढ़िया से। हम तो देख रहे हैं कि यही प्रचार हो रहा है एड्स के विषय में। जितने भी एड्स प्रिवेंशन है वो सब आकर के जगह जगह पर ड्राइवर हो, खलासी हो या और अन्य कोई भी हो जो गलत लाइन में जा रहे हैं उनको आप शिक्षा दे रहे हैं। ये चीज़ सब हम लोग नेशनल हाईवे में देखते रहते हैं। जगह जगह पर साइन बोर्ड लगा हुआ है, जो पढ़ा लिखा है वो साइन बोर्ड पढ़कर भी ज्ञान प्राप्त कर सकता है। और जगह जगह पर कॉन्डम रखा गया है कंपनी के सामने, दुकान के सामने। जिन ड्राइवरों को, जिस किसी को, जैसे हम है, मैं जानता हूं कि हमारे पास में कॉन्डम रखा हुआ है, तो हम जो भी ड्राइवर आते हैं उन सबों को मैं बांट देता हूं। और मैं अपने हाथों से कम से कम 4-5 साल तक यहाँ पर जो ढिल्लो रोड लाइन है ना, यहाँ पर रखा गया था, और हम अपने हाथों से और उन स्टाफों के हाथों से वितरित किया गया है। और मैं इस कार्यक्रम से बहुत सहमत हूँ। ये जो भारत सरकार का जो सिस्टम है ना, ये बहुत अच्छा है। और ऐसा हमारे पूरे हिंदुस्तान तो क्या पूरे विश्व में इस तरह की बीमारी का नामो निशान ना रहे, तभी ये देश सही ढंग से चलेगा और विश्व भी सही ढंग से रहेगा।
One-to-one counseling is another of our major successes.
আমাৰ নৰ্থ ইষ্টত তথা উত্তৰ পূৰ্বাঞ্চলত যিবোৰ ট্ৰাক ড্ৰাইভাৰ আহে তেওঁলোক বহুত দিনৰ কাৰণে ঘৰ বাৰী এৰি আহিবলগীয়া হয়। তেনে ক্ষেত্ৰত তেওঁলোক আমাৰ ইয়াতে গুৱাহাটীত বা নৰ্থ ইষ্টত গোটেই ট্ৰাকবোৰ জমা হয়, তথা তেওঁলোক আনপ্ৰটেক্টিভ সেফনেছ লৈ পালে তেওঁলোক সেক্সুৱেল পাৰপাছটো কৰে। গতিকে এই সেক্সুৱেল পাৰপাছ কৰাৰ বিনিময়ত তেওঁলোকৰ মানে সেক্সুৱেলি ট্ৰেন্সমিটেড ডিজিজটো আমি দেখিবলৈ পাওঁ।
Among our other notable success stories is the Integrated Health Services Project, or IHSP, for prevention of mother-to-child transmission of HIV/AIDS in Assam, carried out in 40 localities through our community health centers. This project, implemented with support from the European Commission, provides antenatal care for pregnant mothers where voluntary counseling and testing is integrated. Safe delivery services and postnatal care are also provided by us through the community health centers. Our outreach workers at the APS has also been targeting other high-risk areas like people living on the streets through our street-level intervention for AIDS awareness among general population in Guwahati city. This project, supported by the US State Department, is primarily aimed at raising the level of awareness about HIV/AIDS among the people at the street level who do not have the access to other medium of information. Our workers conduct awareness programs among the street people on a daily basis. Our medical teams also provide sexually transmissible infection treatment to those people needing help at the street level using syndromic case management principles and provide condoms.
APS has a well-structured system in place. Every project is managed by experienced coordinator who monitor and evaluate the functioning for effective results.
We focus on the sex workers as well. Project Sakhi, a peer-based intervention among sex workers, is another highly successful and result-oriented program. Our outreach workers provide the sex workers with knowledge on HIV/AIDS besides encouraging the need to go for protected sex.
ये हमारे सभी जवानों भाई से मैं अनुरोध करूंगा कि किसी प्रकार ऐसे औरत से संगम ना करे या संबंध ना रखे जिसके अंदर बीमारी हो। इससे हम सबका जान बच जाएगा और हम लोग सब सही सलामत में ज़िंदगी बिता सकते हैं। मेरे साथ जो हुआ है ये इसी तरह से हुआ है, जो कि हमको पता नहीं था, लेकिन हम इस बीमार से भोग रहे हैं। अब भगवान जाने हम कितने कहाँ तक हम पहुँच पाएंगे, हम ठीक होंगे या नहीं होंगे, ये तो भगवान ही बता सकते हैं।
Our resource persons and other experts often reach out to communities where the risk of drug addiction and spreading of HIV is the maximum. Our expertise is often sought for creating awareness and counseling. Very often, we act as a support to women groups who are themselves fighting a battle against drugs and HIV. These are women vigilantes at the heart of Assam's principal city of Guwahati, patrolling their locality with flaming torches at night. The women, after finishing dinner, come out on the streets and guard the area to check peddling of drugs, besides combating other crimes. At times, experts from the APS are invited for guidance and support. It is here we play the role of an interventionist. Our experts at the APS have imparted training to more than 300 general practitioners and other NGOs on HIV/AIDS in Assam and Meghalaya states under the project Rajiv Gandhi Workforce for Prevention, Control, Management of AIDS in Northeast India, supported by the Rajiv Gandhi Foundation. Our other modes of dissemination of information regarding HIV/AIDS are through various information, education and communication materials or IEC that we produce at the APS. The quarterly newsletter AIDS Scan, leaflets, pamphlets, slides, 1097 stickers and posters are being produced regularly for greater dissemination of HIV/AIDS prevention messages among the masses. HIV was first identified by Professor Luc Montagnier and Professor Robert Gallo. It is very important for all to know how HIV is transmitted. HIV is transmitted primarily through semen and vaginal fluids during unprotected sex without the use of condoms. Besides sexual intercourse, HIV can also be transmitted during drug injection by the sharing of needles contaminated with infected blood, by the transfusion of infected blood or blood products, and from an infected woman to her baby, before birth, during birth, or after delivery. HIV is not spread through ordinary social contact, for example, by shaking hands, traveling in the same bus, eating from the same utensils, by hugging or kissing. Mosquitoes and insects do not spread the virus, nor is it waterborne or airborne. The man behind the successful running of the APS is Dr. S.I. Ahmed, one of the region's well-known AIDS activists. Dr. Ahmed is a clinician with a postgraduate degree in tropical medicine from the United Kingdom, besides another PG degree on STD and HIV/AIDS from Thailand. He has been trained on clinical management of HIV/AIDS in some of the world's well-known institutions like Hospital Bruces in Paris, San Francisco General Hospital and University of Pittsburgh Medical School. He has been invited with an international award at the Conference on HIV Pathogenesis and Treatment held at Paris in 2003 that was organized by the International AIDS Society. One can only hope that the collective efforts carried out by the likes of APS would go a long way in slowing down the HIV/AIDS epidemic in India's northeast. As the cliché goes, there is always a light at the end of a dark tunnel.